Okay. Alright, I'm Samuel, and I'll be talking about the workability and the disadvantages of therapeutic cloning. Now, throughout this argument, the topic has been about therapeutic cloning. The proponents clearly stated that reproductive cloning is not the goal or should not be involved with therapeutic cloning. However, although they have different names or terms, what they fail to realize is that therapeutic cloning and reproductive cloning aren't so different, which brings me to my first workability claim. Therapeutic cloning will result in reproductive cloning. According to medterms.com, reproductive cloning is the human cloning for the purposes of creating a human being. For therapeutic cloning, MedTerms states that it is a procedure where skin cells are taken from a patient and inserted into an unfertilized egg whose nucleus has been removed. Scientists then extract the stem cells from the new embryo to potentially be transplanted into a patient to treat diseases from which the patient suffers. Now, definition-wise, they are different, and term-wise, they are different, but the procedures are very similar. They both require an unfertilized egg, which is infused with a patient's skin cell to form a cloned embryo. However, the only difference is that reproductive cloning, the embryo eventually grows to be a human being. But for therapeutic cloning, the object is to extract the stem cell, killing the embryo. Both procedures are almost identical. Now, a scientist's job is to prove things. Their goal is to find a breakthrough, discovery, or invention. Their job is to theorize and then conduct experiments to see if they're right or wrong. So what's to stop them from conducting a reproductive cloning experiment? According to John Rowlandson of ExploreStemCells.uk, because reproductive cloning does utilize SCNT as a primary step, there is also still fear that given our knowledge base to perform reproductive cloning, a scientist may attempt to move beyond therapeutic cloning to the creation of a human being. By allowing therapeutic cloning, you're also possibly allowing reproductive cloning. The fact that they're so similar gives scientists an opportunity to do something that no one has ever accomplished, but which is also illegal, and that's to clone a human being. My second workability claim is that scientists can't accomplish the goals predicted or assumed. Also, from the same definition of medterms.com states that therapeutic cloning can possibly cure diabetes, Alzheimer's disease, and Parkinson's disease. Cancer and AIDS are also another possibility. Now, this sounds great, and who wouldn't want this? But the fact that remains that we lack technology and knowledge to accomplish these goals. Our first problem is that scientists can't grip the understanding of what cloning and stem cells are. Nancy Touche, a writer of Genome News Network, states that you can imagine a liver cell happily minding its own business being a liver cell. But if you put this liver cell into an egg cell, she adds, then expose it to factors that researchers don't know anything about, suddenly that nucleus humming away as a liver cell has to switch off its genes and say that make me a liver cell, or to turn off genes and say now make me into an embryo. The whole slate has to be wiped out clean. What she says is true. You just can't take an egg stem cell and just turn it into another organ. Something is about to fail. That stem cell was designed to form into a possible human being, but to take that away and transform it into an organ seems impossible. Another issue that Nancy Touche brought up was the term of embryos, which brings me to my second point. And the biggest problem is that scientists can't seem to keep the cloned embryos alive. The first step of therapeutic cloning is to have an embryo. But James Meek, a journalist of The Guardian, says, but each clone is made with enormous difficulty and great cost and huge loss of unviable embryos, such that they are not ready to be practical use for farmers or scientists. Nancy Touche also writes, typically less than 10% of these cloned embryos survive. Those that do survive often at birth are oversized, have abnormally large placentas, and die at a younger age. Now, of course, they're talking about animals, but if you were to infuse that to humans, then you're going to possibly kill off thousands of potential human beings, which brings me to my first disadvantage claim, is that therapeutic cloning kills off possible human life. Now, the embryo is the first stage of human life. For humans, it is the first 6 weeks after fertilization of the egg. After embryonic stage, it is then called the fetus, which then comes birth. To allow therapeutic cloning, once the embryo is made, it is killed for the collection of stem cells that it produces. In the end, scientists kill off potential life. Now, of course, these organisms don't have a mind and can't feel pain, but the the fact remains that it's living and it is alive and it's a person. And my second claim is that therapeutic cloning will result into human testing. Now, embryos, you can consider yourself as a human, but other things can happen. In reality, women are being tested as of right now. Emily Singer, a writer of Technology Review, writes, unlike other embryonic stem cell research, these experiments require an unfertilized egg. However, egg donation procedures is uncomfortable and potentially painful, and it carries out some medical risks. Women must undergo counseling sessions to understand the risks involved, hormonal treatments to stimulate ovulation, and a medical procedure in which, in rare cases, can cause kidney damage. Now, of course, these women are getting paid, but this isn't a medical procedure. A medical procedure, also called a surgery, is a procedure where you need to get something fixed medically. If you have a problem, like a broken bone, you get it fixed with a doctor. However, in this case, these women are perfectly fine. They don't need anything fixed at all. There's nothing wrong with them. If that's the case, then what these scientists are doing are experimenting with this woman. These women are test subjects of scientists who just want one thing, which is their eggs. Now, if biotechnology or biotechnists are willing to pay women for their eggs to conduct this experiment, what's to prevent them from conducting an experiment on someone who wants to be cured, or who has Parkinson's disease or AIDS? They could just allow them to pay money and then have an experiment to potentially cure them, but then it's not potentially cured because it's very insufficient and unstable. My final claim is that therapeutic cloning will be too expensive. Not only will biotech companies pay for women's eggs, but then patients will have to also pay for much higher costs than what is available to them right now. Matthew Herper of Forbes magazine writes, such high costs are unheard of in biotechnology. For instance, treating a patient for a year with a rare joint disorder called Gaucher's disease with Genzymes, a medical company, Zymes, can cost up to $170,000. Now, if this just costs $170,000 for one procedure for 1 year, can you imagine how much it'll cost to have a new stem cell transplant for this rare disease or for an organ transplant? Not only will you be paying a medical bill for your surgery, but you'll also be paying for the biotech's services for the stem cells or whatever you need. So after hearing my workability claims and disadvantage claims, I hope you realize that therapeutic cloning could have its possible benefits, but the cons outweigh the pros. And even though it sounds pleasing to the ear, it will do more damage than positive.